is the end of Chapter 4, I believe, on the spine and thorax in your trail guide. I'm sure you're as sad as I am to see it go. Let me present my screen here. So, can you all see the screen, the spine and thorax thing? Anybody? Yeah? No? Yeah, okay. So today we're going to learn about essentially breathing muscles. And the diaphragm is your main breathing muscle, but you have other breathing muscles that help you breathe. And those muscles are your intercostals. Your intercostals, and sorry, by the way, I'm trying to talk to you and read side comments, and I cannot multitask. And then they're funny sometimes. Anyway, your diaphragm is your main breathing muscle. It's the one you use all the time. You have some other ones that support that. You have intercostal ones, which intercostal just means between the ribs. And you have internal and external intercostals. We'll get to that. And then you guys already know about the serratus anterior, but I said if you name a muscle serratus anterior, there's got to be a serratus posterior. And today we're going to find out there's actually a serratus posterior superior and posterior inferior. And this will all make sense when we look at them. And all of these muscles combined help you to breathe. Why do I care as a massage therapist? So before I show you these muscles, why do I care as a massage therapist?
Why do you care that it helps you to breathe?
Yeah, yes.
Is that what you're getting at?
Yeah. So Miss Petrie correctly identified that obviously one reason I care is that you should breathe, and right.
Right.
But why might I want to massage these muscles, for example? Why might these muscles be problems for people? That's what I meant. Why would I want to address these as a massage therapist?
So you can help them take deeper breath, larger breath.
Actually, that's a brilliant answer. So, yeah, sometimes people get constricted breathing. And your lungs are the carburetor for the engine.
But you don't know that if that's just normally how you breathe.
Right.
You don't realize that these muscles are contracting and are not allowing you to get all the airflow that your body really needs for you to have.
Yes, absolutely.
Can I add something to that?
I would hope you would.
When those muscles are, what is the word, restricted, a lot of times it'll send other stuff into a muscle spasm that they're attached to.
Yeah.
And so people will feel like pain in the upper back, and when they take a deep breath, or they'll feel like they can't breathe. So again, with what Miss Petrie was saying, but I think it sends other stuff into a spasm. And I don't know if that's because, like, are they glued together at that point or what? But I know that a lot of times people would think that they have a rib out.
Yeah.
Just because they felt a restriction in breathing, but it wasn't necessarily that.
Yeah. Yeah. Well said, everybody. Yeah, so there's a couple aspects to working on breathing muscles that we really care about. One is a performance aspect. So if you're an athlete and you can take deeper breaths, theoretically, like I said, your lungs are the carburetor for your body. And I use that term because a carburetor really does bring in oxygen into your engine to help the gasoline burn. And your lungs really do bring in oxygen into your body to help you burn ATP, by the way. If you can take deeper breaths, if you can expand your lungs better and easier as an athlete, that makes life a lot better. So there's a performance aspect. So if you have athletes that come in, this could be something that might be important. You might want to expand their diaphragm, their intercostals, and their serratus anterior and posterior, serratus posterior superior and serratus posterior inferior. The other aspect is kind of what Miss Petrie and Miss Monreal are also talking about, which is these muscles sometimes become tight and restrict breathing, and sometimes people don't even realize it. So, and that has a mental aspect to it too, and a physical aspect. So when you don't get a lot of oxygen in, your other muscles get tight. Oxygen and blood flow tend to keep your other muscles loose. And if you restrict oxygen for people, and they don't get enough oxygen in, and they don't get enough blood flow in, their other muscles get tight. So it adds to tension in their life. And it adds to problems in their body. And so they're not getting enough air in. That's a problem in and of itself. The other problem is tight breathing tends to give people anxiety. And they sometimes don't even know it, that they're kind of breathing kind of shallow and that they're kind of constricted, and that's kind of causing some anxiety for them too. And anxiety tends to add to your tension. So you get these cyclical loops, right? Where I've got anxiety that's making my chest tight and my chest is making my anxiety tight. Or I've got shallow breathing because I can't breathe fully and I'm not getting enough oxygen, which is making my muscles tight, which is making my shallow breathing a problem too. So they all kind of cycle. So expanding rib cages, which is, remember we were pushing up on rib cages in the lab and stuff like that? That's the reason I was doing it. We were moving all these muscles when we were doing that, because these muscles are between your ribs, attached to your ribs. All these muscles, intercostals, internal, external, diaphragm, serratus posterior superior, and serratus posterior inferior, they all attach to your rib cage. So moving around your rib cage can help to stretch them. Yes, Miss Petrie? Was that a raised hand?
Yes.
Okay.
I wanted to share something that I read last night.
Woo!
That said that not only is it for the intercostals, not only is the area linked vitally with respiratory function, but also with the feelings of love, courage, and inspiration. I thought that was interesting.
It's very interesting. Why do you suppose that is?
Well, when you hug somebody, isn't that like a main area that you wrap your arms around?
Sure.
Is a thoracic area, so that could be the feelings of comfort and love, and the idea of breathing fully also can give you some of that same feeling, in a sense.
Yeah, I was listening to you very carefully.
To like really breathe.
Yeah. I don't know if this...
Like
Oh, go ahead, sorry.
Yeah, I don't know.
No, I was listening to you say this. I don't know if this sounds too like hippy-dippy or whatever, but I was actually thinking about when you said the word grieving, I do think of grieving as being something in my chest, right? I don't think of grieving as being something in my legs. It's this feeling, and I think of love, I kind of think of something in my kind of chest too. It's very interesting. So you're right, I have an emotional response in that area of my body. Yeah, that's fascinating actually. I've never thought about that in my life. Very cool. Yeah, so anyway, we're going to learn about these muscles, and that's why I'm just trying to frame the discussion. This is why you might want to work on them, right? Helps people to get more oxygen in their body so they loosen up, better performance, that sort of stuff. And remember, we have lots of stuff that can contract our breathing. If these muscles are tight, it can make it hard to breathe well. But there are non-breathing muscles that can make it hard to breathe well. There is a band around your chest created by three muscles that can create a tension around your chest. These aren't breathing muscles, but they can band around your chest. And when they get tight and fight with each other, that can create a problem with your breathing. Can anybody tell me what that band is? Kind of around my chest and back of these muscles, these three-ish muscles. If you get any of them right, they can fight each other, kind of work with my scapulas and can kind of fight them back and forth and can actually kind of create a band around my chest to make it tight.
It's not the transverse abdominis.
You know what? It's so funny. When you said that, that's not what I was shooting for, Miss Hunter, but that's exactly what I thought. The transverse abdominis, by the way, is a band around my belly. And so the way I phrased the question, right when I was saying it, I was like, they're going to think transverse abdominis. That's an excellent answer. That is a band around my belly. Could affect breathing because it's down there, but I'm talking about up around my rib cage a little bit. Yes, Miss Cooper, was that your hand raised?
Yeah, I'm just guessing because of our homework. Is it that coastal margin?
Yeah, well, but we've already learned the muscles I'm talking about. We've already learned about. I've talked about them arguing with each other. I've talked about them. Their argument can create a tension around your rib cage, and so I'm trying to review that concept. I've talked about when you loosen up the shoulder. Oh, go ahead, Ms. Torres, please.
Pectoralis major.
I'm sorry. What now?
Pectoralis major and serratus. No.
Serratus anterior, yes. So what does serratus anterior argue with?
With me. I'm just kidding.
Rhomboids.
Rhomboids. Don't forget, everybody. Super important. Super important. Don't forget Mr. Skelly here. He's got, or she's got, muscles that attach from the spinous processes, from the middle of the back. That means they're on both sides. These are the rhomboids. They hook to the medial border of the scapula and to the serratus anterior. Serratus anterior comes underneath the scapula and attaches to the medial border. So if you looked at this, if I pulled back the arm, you'd have a band of the rhomboids turning into the serratus anterior that go into the ribs up here. If you want to throw a third muscle in there, pec minor, kind of pull on that too. That's what fights. Pec minor and serratus anterior can fight with rhomboids and serratus anterior and pec minor can fight with rhomboids major and minor. They create a band around your chest. That's why when you guys rub people's shoulders, I know for a fact when you loosen up their rhomboids through their middle traps, I know for a fact you're coming up here and loosening up pec minor. I'm sure you are. And you're also getting the side ribs here to loosen up the serratus anterior to make sure that you've completely loosened this person up and you haven't just given them a temporary patch like a regular, typical loser massage therapist would do, just rubbing the rhomboids. You get the entire chain every time, of course, right? Yes.
So the pectoralis minor argue with the rhomboids? Is
Yeah.
that what we're getting at? Okay. I
Yeah.
just wanted to make sure I understood that clearly.
So this is my left scapula. It would be back here. Quite literally, serratus anterior hooks here, rhomboids hook here, rhomboids pull it back, serratus anterior pulls it forward, and in front on the coracoid process is pec minor, and it pulls it down and forward too. Rhomboids pull it up and back, serratus anterior and pec minor pull it down and forward. And they most definitely could argue with each other. They're also just meant to move your scapula in protractions and retractions and elevations and depressions. But yes, serratus anterior and pec minor tend to work together. Rhomboids major and minor tend to work together and do the exact opposite. And they create a band around your chest. And I think every one of you that I've touched up here has been like, oh yeah, I'm tight. Oh yeah, ow. Of course you are, because if you have any tension in your shoulders, you're going to be tight here. But most therapists miss all this, and they usually miss serratus anterior too. And why is that a problem? Because yes, loosening up the rhomboids will give them relief, but if the serratus anterior and pec minors are still tight, they will pull on them and a day later they'll be tight again. If you solve both sides of the problem, they stay looser longer. And you'll have clients tell you this. They'll be like, I don't know what it is you do, but when I go to you, I stay looser for like a couple weeks, and when I go over to Henry or Jack or Sally, I just don't, it feels about the same, but it only lasts a day. And you'll be like, well, they don't understand about fascial chains and how things argue in your body and the structural architecture of your body, but it's no big deal. Cool? So anyway, I'm bringing all this up just to talk about the elements of breathing and things that can constrict your body and to remind you guys about common things you want to kind of pair together. Let's talk, though, just about these breathing muscles now. Okay, can we see this slide with the serratus posterior superior and the serratus posterior inferior? They're called serratus muscles because they have kind of saw-like projections. If it helps, let's look at Mr. Skeleton here. The serratus, gotta go this way. Serratus, these do not go to the scapula. They go from the spine to the ribs. And they kind of look like this. And so if they contract, if I hook something on the spine and I hook it down to the ribs diagonal down here and it contracts, what would it do? Anybody? What might it do? Are you talking, Ms. Petrie?
Would it elevate?
Elevate what?
Elevate these shoulders?
It's not hooked to a shoulder.
Oh.
It's hooked to the ribs.
Oh. Well,
Keep going. You're saying the right thing. What would it elevate? It's hooked to the ribs.
it would. The chest?
What is the chest?
Elevate. I don't know what's gonna elevate. In my mind, I think it's gonna elevate something.
Well, it's hooked to the ribs. What might it elevate? Say the ribs.
The ribs?
Yeah! Sorry, you were overthinking it. I apologize. But I'm like,
Sorry, I thought it would be some deeper answer than that.
yeah, I know. You're thinking stuff attached to the ribs. You're like, the chest? And you were right. The chest was right too. And you're right, the shoulders might go up with the ribs. You're right about that. But anyway, yeah, it hooks the spinous processes to the ribs and it goes down here diagonal, but the ribs can't move diagonal, so it will elevate the ribs. Yeah. And if I have one down here, it's kind of hard for you guys to see because of the way I have the camera, but if I have one here, kind of going diagonal from, kind of going diagonal from the ribs down to the spinous process down like this, and it contracts, what might it do? We have one diagonal this way, elevating the ribs. What might one diagonal this way, going from the ribs to the spinous processes do?
Depress?
Depress the ribs.
The ribs.
Yeah. So let me ask you something. We haven't even gotten to them yet. This is what's so neat about what you guys can do now. You guys can see an action without reading it in your book, which means you don't have to memorize actions. And this is a really big deal because I guarantee you when you graduate, you'll go talk to other therapists and they'll be like, yeah, I kind of know where that muscle is, but I don't know its action. And you'll be like, but it goes from here to here, so the action has to be here. And they'll be like, how did you know that? So you said, Miss Petrie, that the ones up here, when they contract, they elevate my ribs, right? Like that. And the ones down on the bottom depress my ribs. Like that. So, which of those two muscles, because it's not both, because they do opposite things, which of those two muscles, serratus posterior superior or serratus posterior inferior, which one of those two muscles helps me with a strong inhalation?
It would be the upper.
Yes, serratus posterior
But then when
superior. And then
Let
which
the
one helps
air
me with
out.
exhalation? Serratus posterior inferior. Yeah. Now, by the way, I don't have to use serratus posterior inferior or superior unless I'm doing a very strong inhalation. But there are times I want to do a strong inhalation, right? And exhalation, like when I'm running. And I want the pumping action to be even stronger. Or when I'm doing demonstrations for students and doing this. That requires extra muscle. And that's when the serratus posterior superior and posterior inferior kick in. I don't even have to go to the slide. You guys already figured it out. So anyway, these are fairly deep muscles. We will get to them in a second, but let's go to the diaphragm. At least one person on their homework wrote, and I appreciated it, they said this is a confusing muscle to talk about because of the origins and insertions. And yes, and it is a confusing muscle to talk about because of the origins and insertions, because it does not have an insertion. I know the book has it as an insertion, but it doesn't attach to a typical insertion. So we're used to like our biceps, and there's an insertion here and an origin here, and that's the action. This is very different. So if you can see this picture of the diaphragm, you have to remember it's hollow inside. It's an umbrella inside your rib cage. An umbrella. So it's a dome. It's a dome inside your rib cage. So imagine this three-dimensional. It's a dome both ways. It's a dome like this, though, inside your rib cage. That's what you're seeing a picture of. This is it relaxed. When it contracts, it attaches to both sides of the rib cage. When it contracts, it shortens, which means it comes down like this. Because this is much longer than this. So when it contracts, it actually comes down. So this is me when I breathe out. This is me when I breathe in. Because when I do this, my lung capacity opens up. My rib cage opens up inside. So when it tightens up, let me give you a different example, just so you can see this. Now, it would be going all different directions, right? It's a dome. But when this tightens up, it flattens. It gets shorter, it flattens. Flattens. So there's not a lot of room in my lungs right now because I've exhaled. When I do this, it opens my lungs up inside and I breathe in. Yeah? So, they say the origin of this muscle is all the ribs around it, and that's true. Kind of like it's sitting there with all the ribs around it. That's the origin of it. They say the insertion is this thing called the central tendon, which is just the center of the dome. And the central tendon is kind of hooked to a sac around your lungs. And when it comes down, it brings the whole thing down. But it doesn't really have an insertion, right? It's just this dome where all the muscle comes together, and they don't know how to talk about that because they talk about all muscles in terms of origin insertion. So, I've got, can we see this? I've got, let's make sure we can really see it. Yeah, there we go. I've got a dome up in my rib cage. A dome. It attaches to my ribs all the way around here. When that dome, that's like this inside here, flexes, it actually comes down because it gets taut across here. And when it comes down, it creates a vacuum in here that makes my lungs breathe in. That's how your lungs work. Yeah? Let me see really quick if I have I might actually have a breathing thing because it will really, really help. Bear with me 1 second. I want to see. Aha. Let's see if this will work. Da-da-da. Hold on, everybody. Trying to find you a picture of that is not very helpful. Bear with me. Da-da-da-da. Oh, there we go. Okay. Trying to find a all right. Okay, I'm going to share this with you. Bear with me. Okay. Hopefully. That didn't help me. Sorry, everybody. My computer's giving me a hard time. But I feel like you have to see this. Otherwise, it won't make any sense at all. Okay, let me share this with you and see if you can see it. And take it from there. All right. All right. There we go. Oh, come on. Sorry for wasting your time. All right. So I have to stop sharing for a second because I've got to share a different screen. All right, there we go. Okay. This is very hard to see, but you should be able to see the diaphragm here. It's in red. There is a muscle in back in red also that's not the diaphragm. Does anybody know what that muscle is in back in red? That's not the diaphragm? There's the diaphragm's in red, but there's another muscle in back too.
Is that the psoas?
Let's see. I actually think, well, it goes from the crest of the ilium and not down in there. So I was thinking it was quadratus lumborum. I think it is.
It just looked kind of skinny, but
Quadratus lumborum is skinny. Yeah.
It is skinny?
Yeah.
I don't know why I thought it was just fatter.
And you see how this thing hooks to the crest of the ilium and goes to the transverse processes of the lumbar, not the fifth lumbar, but the first, second, third, and fourth. That's what ilios. I mean, that's what quadratus lumborum does. Okay, so everybody, watch this video. Do you see how the diaphragm goes? It's very hard to see, but when it turns green, the muscle is flexing, and the diaphragm goes down. Do we see that? All right. And when it goes down, it creates a vacuum inside your chest, which is how your lungs work. Here is another one. Here's a side view. Do we see that? The top part that's white there, a little bit, is the central tendon. That is how you breathe.
So if someone has a weak diaphragm, then they're going to have problems breathing, correct?
Yeah.
And why would somebody have a weak diaphragm?
I have no idea. I would guess, I mean, because your diaphragm gets worked all the time, I would guess you had a weak diaphragm. It would be due to a pinched nerve. Because I've not mentioned this before, everybody, but you can have muscle weakness because your muscles are weak, right? Just because you haven't worked them out and they're weak. But you can have muscle weakness because the signal's not getting to your muscle. So people that hurt their back sometimes, their legs are weak and stuff like that. It's not like they lost all that muscular power right away. It's that the nerve impulse isn't getting there to fire the muscle. And if you can't fire the muscle, you're weak.
So how about if people very angry cannot put out, and so in the make them in the I don't know, and maybe make them in the very thin on side, and I think in the cannot breathe.
Because very angry?
Yeah, but sometimes you very angry inside, but you can't in the talk and cannot. In the
Oh, yeah, yeah,
How about that?
sure. You get so angry you can't talk, and
You can do everything, and
Sure.
so making the inside and the not relaxing, and so in the make the, I don't know how to talk about that.
everything.
But
When people get really angry, sometimes everything does get kind of locked up. Yeah.
the muscle in the very I don't know how to say this talk in that, but in the I don't know.
Yeah, I hear you. I do think that can cause breathing problems too. Absolutely. Okay. Let me get back to where we were. So that's the best video I've got of breathing. Sorry. But again, you've got this dome here, and if you think about it, if I have a dome and it contracts, it goes flat. And if it goes flat inside a vessel, it creates a vacuum. And that's how I breathe in. So when I breathe in, my diaphragm is actually going down. When I let go of my diaphragm, all the air goes back out. Yeah? Yeah. So the attachments that I actually care about of the diaphragm are all of its origins. And that's the inner surfaces of the lower 6 ribs, the upper lumbar here, and something called the xiphoid process. What bone does the xiphoid process come off of, everybody?
The sternum.
Sternum. Thank you. So this thing wraps around these bones here in the inside of your ribs. Xiphoid process is really part of your ribs. I know it's part of your sternum, but your sternum is part of your ribs. Hooks to your ribs here, and it hooks to your upper lumbar here. And so when we're pushing on ribs and all that kind of stuff, we're helping stretch out the diaphragm too. That's it. They say the insertion is the central tendon, but the central tendon is just the top of this dome where all the stuff comes together. I don't really care so much about that. Because really, to me, the origins are the insertions. It all just kind of comes down like this. Yeah? Questions about that?
Yes.
Yes,
So
please.
it's the lower 6 ribs, the upper lumbar, and the xiphoid process. That's
Yeah.
like the connection.
Yeah, if you look at the skeleton here, and if I took my hand and just went around him or her, I would be hitting the lower 6 ribs. I hit across these lumbar vertebrae right here. I'd go across these lower 6 ribs, and I hit this xiphoid process. It's just painted on the inside of here, a dome, a mushroom-like, an umbrella-like, very much like an umbrella, that's attached that way to the inside of the ribs all the way around. And so when you go around, you hit the xiphoid process, these lower 6 ribs, these lumbar vertebrae right here, and back around here. And it really does divide your upper body from your lower body, your upper chest cavity from your lower chest cavity. All the lung action is up here, and the heart. Lungs and heart are above the diaphragm. Many people say breathing actually massages the heart because the diaphragm actually rubs against the heart and helps to massage it. Any other questions? Your lungs are essentially like empty balloons, and if you create a vacuum underneath them, those balloons open up. And that's how you suck in air. You create a vacuum inside you, and the air actually rushes in. That's how vacuums work. And the diaphragm's all you need to breathe. The other muscles we're going to learn about help you breathe when you need to breathe harder, or the diaphragm's not working, or you're running. But the diaphragm is your main breathing muscle. Now, if somebody's having a problem breathing, I'd rub all these, but I'm just saying the diaphragm's the big one. And now, can you actually directly massage the diaphragm? Basically, no. I guess you can kind of reach underneath the ribs a little bit and get to it, but you got to go through the abs to get there, and basically you can't rub the diaphragm directly. Can you push up the ribs and have somebody breathe in, push up the ribs, let out, and things like that? Yes. Will that stretch the diaphragm and open up? Yes. So the way I work the diaphragm is to work the rib cage, which is why I showed you guys about pushing on the rib cage. Cool? All right. Love it. Okay. Can we all see this picture that says diaphragm on top? This is you looking up. Like, as ridiculous as this looks, can you see the skeleton right now? Hold on. You see the skeleton? This is you looking up at the ribs. Does that make sense? So that's the vertebrae back there. It gives you an idea of the dome shape. That's why I'm showing it to you. And you can see the esophageal hiatus here. That's where the esophagus comes through. Remember, from the digestive system? That's where your esophagus comes through to get down to your tummy. We see the vena cava foramen. What does foramen mean?
Is that a hole? Oh, okay.
Hole, yeah. Foramen is a hole. And so that's the hole for the vena cava to get back up there, the returning venous supply to get back to the blood. That's the hole for the inferior vena cava. Cool. But you can see how the diaphragm is sewn to the entire inside of the ribs there, the lumbar vertebrae, and the xiphoid process. And when it contracts, the dome goes down and it flattens. And that pulls the lungs down and creates a vacuum up here and the lungs fill up. Good job. Okay, let's talk about the intercostals. Who here likes baby back ribs? Barbecue baby back ribs? Miss Petrie? Miss Monreal? Gotcha. Oh. Mr. Kadaris? Cool. You three are eating intercostals. There's nothing gross about that. That's just what you're doing. But you are really eating.
Delicious with barbecue sauce.
Yeah. You are really, really eating intercostals. Like they're exactly the same on a pig and a cow as they are on a person. Those are intercostals. They have them too. There's no difference. I mean, I want to tell you just so you know, like, that's rib meat. It's the meat between the ribs. That's intercostals. Next time you can be like, let's go out for intercostals. Right? And here's the interesting thing. You've got external and internal intercostals. Do you remember our external internal obliques? Down here on my tummy tum? Remember? I feel like I need this camera farther away from me sometimes. Let's do this. Do you remember? Got me. All right. Remember when I was like, external obliques, internal obliques, right? Remember how they're crisscross? Crisscross applesauce? Yes? Your intercostals are exactly like this too. The idea is one helps pull the ribs down, the other one helps pull the ribs up. I'm not worried about that. They both pull the ribs together. Don't get too obsessed with that. But next time you're eating ribs, look at one side, flip the ribs over, and the meat will be running the opposite way on the other side. Between the ribs. This is all between the ribs. You will actually see the internal, external intercostals. You'll see the rib meat running different directions between the ribs. You should go out and have ribs tonight. Just so you can see this. Because internal, external intercostals run different directions. And that's why one kind of helps with inhalation, one helps with exhalation because they pull in opposite directions. But that's not a big deal. And that's a little controversial too. The point is they can pull the ribs together, right? They believe that one can actually help lift the ribs up, the other one helps pull them back down, kind of like serratus anterior and inferior. But all I want you to remember about intercostals, we don't have to get this nitpicky, is you have meat between your ribs that helps you breathe. How do you rub it? You can actually find people's ribs and rub between them. You can actually take your hand, grab by where you find the ribs and try to trace their ribs around. And you're going to find the ribs don't run like you think they do. They kind of come down and back and around. Go trace somebody's ribs today. It's fun. Between the ribs, by the way. Your fingers will fit there just fine and trace around them. Have them breathe while you're doing it. So we've learned about the diaphragm and the intercostals. You have internal, external intercostals, but they're all found between the ribs. If you have to know the origin and insertion for the test, like online test, I really honestly don't remember what it asked you, then fine, use your book for that. But I can promise you at the end of the year, I'm not going to ask you for nitpicky origin and insertion of intercostals. I just want you to know they're between the ribs. That is plenty. You don't have to be like, this one attaches to the upper rib and this one attaches. They're between the ribs. There's nothing else between the ribs. That's what the name means. Cool? They're between the ribs. They can help you with inhalation and exhalation depending on which way the fibers run because you have an internal and external. That's it. You don't have to know which does which even. Doesn't matter. Okay, any questions about that? And by the way, I'm not trying to I am trying to oversimplify it, but I'm not trying to oversimplify it. There's a lot of argument actually whether the one can actually help with inhalation or exhalation because they all pull on each other. That's why I'm not getting caught up in all that baloney. The fact is they can move the ribs around, they can help with breathing, and they're found between the ribs, and you eat them when you eat ribs. That's the stuff. And they run in opposite directions. Cool? All right. So that's diaphragm, intercostals. Let's talk about serratus posterior superior and serratus posterior inferior. Do not forget your directional terms. This means the saw-like muscle, serratus, posterior, found on my back side, superior, there's one up there, and inferior, there's one down there. So we're talking about two different muscles. Serratus, posterior, superior, and then another one, serratus, posterior, inferior. Cool? Up and down. Right? The up one actually lifts, as Miss Petrie told us so astutely, lifts the ribs up to help me inhale while my diaphragm is coming down. The bottom ones, the serratus posterior inferior, pull my ribs back down if I have to do a forced exhalation. You don't usually do forced exhalations, except when you're running. Right? When I'm running, I actually want to get my air out quick, so what? So I can get another breath in. So normally I just breathe like, I just let my air out slowly. But when I'm running, I'm not only breathing in hard, I'm breathing out hard because the harder I breathe out, the next time I get another breath in. So it's like, and that's serratus posterior superior and serratus posterior inferior. Yeah? Let me tell you one other really cool thing about these that makes them very easy to remember. They're saw-like, okay? Hold your fingers out like this. No thumb. Give me 4 fingers. Saw-like. These muscles each have 4 fingers. They go from 4 spinous processes to 4 ribs. 4 spinous processes to 4 ribs. 4 spinous processes to 4 ribs. This one goes from the spinous process of C7, T1, T2, T3. That's 4 spinous processes, right? 4 spinous processes. And it goes down to ribs 2, 3, 4, and 5. Down like that. 4 spinous processes connecting to 4 ribs. You can kind of recognize them that way when you see them in a picture, because you're like, oh, those 4 diagonal muscles, right? The one down at the bottom goes from 4 spinous processes too, right? Goes kind of down here backwards from L3, L2, L1, T12, right? To the last 4 ribs. Ribs 9, 10, 11, and 12. 9, 10, 11, 12. So that 4 concept is something I want you to remember. These muscles attach, whether it's the serratus posterior superior or serratus posterior inferior, they both attach 4 spinous processes to 4 ribs. Yeah? Yeah.
Will you please explain the serratus posterior inferior of which they connect to and what ribs they go to? I'm sorry, I missed that.
Yeah, that's okay. So, let's see. 1, 2, 3. This is, can you see the skeleton, Miss Petrie? Yeah? Yes, no? Oh, okay. Sorry, you're far away from me now. Your picture's small, so talk to me right now. Okay. What region of the spine is this called?
Lumbar.
Lumbar. So this is lumbar 1, 2, 3, 4, and 5. By the way, right above lumbar 1, what is this vertebrae right above lumbar 1?
T12.
Yeah! Good job. Okay. We're going to start down at lumbar 3, to be honest with you, because it'll make more sense. Trust me here. Here's the spinous process of lumbar 3, and we're going to attach it to your 12th rib.
Okay.
Here's the spinous process of lumbar 2. We're going to attach it to your 11th rib. Here's the spinous process of lumbar 1. We're going to attach it to your 10th rib. We're just about done. Here's T12. We're going to attach it to your 9th rib. And look how much that looks like in the book.
Okay.
4 spinous processes attached to 4 ribs. The one up on top, by the way, is, I think it's C7, right? To your 2nd rib, T1 to your 3rd rib, T2 to your 4th rib, T3 to your 5th rib. 4 spinous processes to 4 ribs. Yeah? Miss Hunter.
Yes.
Miss Hunter, how many ribs does serratus posterior superior attach to? Not what ribs, just how many?
1, 2, 3, 4.
Yes. How many spinous processes does it attach to?
4.
Yes. Thank you.
Awesome.
Miss Bolotic.
Yeah.
Miss Bolotic, how many ribs does serratus posterior inferior attach to?
4.
Yeah. How many spinous processes does it attach to?
4.
Yes, ma'am. Thank you very much. Mr. Kondaris. Mr. Kondaris, how many ribs does serratus posterior superior attach to?
4.
Yes. How many ribs does serratus posterior inferior attach to?
4.
How many spinous processes does serratus posterior superior attach to?
Also.
Thank you. How many spinous processes does serratus posterior inferior attach to?
4.
Thank you, sir. Awesome. All right, everybody, I hope we see what I just ran into the ground. Right? Really helps you with origin insertion. Really helps you with origin insertion. And that is serratus posterior superior and inferior. Any questions about that? So, Miss Stanley, let me ask you a question. You there?
Yeah.
Thank you, ma'am. Miss Stanley, of the muscles we just learned, we learned about the diaphragm, we learned about serratus posterior superior, serratus posterior inferior, and we learned about the intercostals. I don't care if they're internal or external right now. If I am doing a really heavy, really strong inhalation, what muscles am I using? What muscles just contracted?
I don't know. I feel like they all kind of play a part in it, though.
Okay, so tell me about them all, which ones you mean.
Well, I feel like the intercostals kind of like.
Intercostals definitely.
Kind of expand.
Yep, intercostals definitely. At least one of your intercostals, internal, external. I forget which ones, but intercostals, sure. Which else? What other?
The diaphragm, I feel like also.
Definitely diaphragm. Diaphragm every time I breathe in. So intercostals and diaphragm on this really strong breath. And what about the serratus muscles?
I feel like the serratus, the posterior, have more to do with it than the inferior.
Wait, serratus what?
Serratus posterior superior.
Yes. The inferior has nothing to do with it. The inferior is going to do the opposite. So the diaphragm, one of the intercostals, I forget whether it's internal or external, and serratus posterior superior lifts up my lungs while my diaphragm opens up the inside. Yes.
Wouldn't the intercostals wouldn't it be the external ones that help?
It would be the external ones, yes, according to the book.
Okay.
Yep, excellent. So, Miss Yanez, if I do a real after, I'm sorry, what, Miss Petrie?
I'm sorry, I have a question.
Please.
From what I understand, is that you can't tell the difference between the intercostals. So how do you know which one it is?
Well, what do you mean you can't tell the difference? I don't understand. I mean, I think you're right. I just want to make sure it's using the same language.
Right. When you're touching those muscles, you can't tell the difference of what's what.
And it's why I was not making the distinction. But Miss Stanley is correct. She was getting more precise. I just was like, the intercostals are involved. The intercostals are involved in a strong inhalation and a strong exhalation. They claim it's the externals that help with the strong inhalation and the internals that help with strong exhalation because of the way they pull on the ribs. And that's probably true. I don't worry about it as a massage therapist because I can't tell the difference. You're working on both either way. Really. Does that make sense, Miss Petrie? I'm agreeing with you, Miss Petrie, but Miss Stanley was correct. She was just getting more precise. But you're right. Don't worry about it. Just be like, 5 years from now, if you remember the intercostals have to do with breathing, that's more than probably every therapist out there. That's plenty. I don't think anybody really worries too much about which side, right? Because nobody's going inside the ribs and rubbing them anyway. So we rub the intercostals, yes. So Miss Yanez, I've taken this big, huge breath. Now I'm going to do a hard exhalation because I'm running. Which muscles of the 5 or 3 or whatever we learned here today did I use to do the strong exhalation?
The serratus posterior inferior,
Definitely.
and I guess the intercostals too.
Yes, thank you. And not the diaphragm, everybody. The diaphragm is relaxing there. The diaphragm doesn't help me breathe out. The diaphragm goes, that's contraction. Muscles can only contract, then it just lets go. If I want to breathe out harder, faster, I've got to use the serratus posterior and my internal intercostals if we want to get really precise. But you were right, Ms. Yanez, thank you. I just want to make sure we put all the information together. Does that make sense? Everybody? Anybody having a kind of a hard time with that? So when I breathe in, my diaphragm contracts and pulls air in. My serratus posterior superior lifts my rib cage up to help even expand it even more, and my external intercostals actually open up my ribs too, kind of open them up too. When I breathe out, my diaphragm just relaxes. I'm sorry, it was flat, relaxes. My serratus posterior inferior pull my ribs back down, and my intercostals, my internal intercostals, pull my ribs back together. But what do I want you to remember in your daily massage life? Is I want you to remember, if I asked you what muscles are involved in breathing, and I'm about to ask you this, if I asked you what muscles were involved in breathing, you would say diaphragm. You should always say diaphragm first. Intercostals, serratus posterior, superior, and inferior, which is actually 2 muscles, right?
Is the diaphragm only relaxed if it's a forced exhalation, or is it just every time you breathe out?
It just lets go. Yep. It just relaxes every time you let go. Yep. My point is,
I understood that correctly.
Yeah, no, it's a good question. My point is, it contracts to flatten. All it can do is let go then. It can't push up. It just lets go. That happens to cause it to kind of push up, but it just lets go. Yeah, good question. So, Ms. Petrie, your diaphragm can help you to breathe in harder. Yeah, I guess it can contract harder, but it can't help you to breathe out harder. It just lets go. If you want to breathe out harder, you've got to use serratus posterior inferior and your internal intercostals.
Okay, so a question with that. I'm sorry. Is the serratus posterior inferior only being used if you're breathing out heavily?
Yes. Yeah.
That's the only time.
Yeah, as far as we know.
It's forced exhalation.
Yeah, because right now, watch, I'll take a breath in. I don't have to do anything to get it out. Breathing out doesn't.
Okay.
If I'm not in a rush, it's a little too much science here, but the pressure of the atmosphere alone, for me just letting go, it just pushes right back out. Collapses
No,
my
I
lungs.
just want to make sure that I'm understanding this correctly.
You are.
That's the only
You
time
are.
that this muscle is being used.
And by the way,
Other than that, it's your diaphragm relaxing when you exhale.
during normal breathing, it's probably only your diaphragm working,
Okay.
in or out.
Okay.
Because I just don't need a lot to breathe. Right now, I'm not breathing that much. My diaphragm's just going. It's not even fully contracting. You know, it's not even using all its fibers. When it starts to get heavy duty, then my serratus posterior superior help open up my lungs. My intercostals help open up my rib cage even more, so I can breathe in faster and harder and bigger. And when I breathe out, my diaphragm can't help me do that at all. But my serratus posterior inferior pulls my ribs back down, and my intercostals pull my ribs back down to help me push out the breath even faster. But that's only on a really strong breath. I mean, I barely feel your rib cage move on little breaths. You're like, right? It's only the big ones where you're like, where the ribs really start moving. And these other muscles move your ribs. Cool? Cool. All right. Miss Harper, what are the muscles that are involved with breathing?
The muscles that involved in breathing is the diaphragm, intercostals, and the serratus posterior, superior, and inferior.
Thank you. That's exactly the answer I wanted. Miss Felix Osuna, what are the muscles that are involved with breathing?
Diaphragm, the intercostals, serratus posterior, superior, and inferior.
Thank you. All right. Perfect. Miss Torres, what are the muscles that are involved
Yes.
with what are the muscles that are involved with breathing?
Your intercostals, your diaphragm, your serratus posterior superior, serratus posterior inferior.
Cool. What is my main breathing muscle?
Diaphragm.
Cool. What muscles do
I want to say diaphragm.
Diaphragm. What muscles do I use in a very strong inhalation? Breathing in.
Your inner intercostals and your serratus posterior inferior.
I don't use my diaphragm when I breathe in?
Oh, I thought you meant out.
Oh, well, then I've got all sorts of problems, I think,
Yes.
with what you said. Inhalation, when I breathe in, what muscles do I use for inhalation?
Okay.
Strong inhalation.
Oh, okay. So it's your diaphragm. What's the same, mother? Your internal costals and your serratus posterior superior and serratus posterior inferior.
Oh, wow. So I lift my ribs up and lift them down at the same time when I'm doing a really strong inhalation?
Oh, no. Just the posterior.
Oh, that makes more sense. I wouldn't pull in two different directions. Okay. So I think you meant external intercostals, but intercostals is good enough. So my diaphragm, my intercostals, and my serratus posterior superior. Right?
Yes.
Good. Okay. I feel better about that. Miss Cooper. Miss Cooper, which muscles do I use in a strong exhalation, breathing out? Like when I'm blowing out birthday candles.
The serratus posterior inferior.
That's the first one I would have given too. Good.
And then the intercostals and your diaphragm.
So my diaphragm can push itself back up again? I thought muscles could only pull and contract. Where did I hear that before? So muscles can It can pull now and it can push.
I mean, your diaphragm's like a balloon.
Yeah? But like, what gets it from here down to here? What is it doing when it comes down? When I breathe in? I know you're talking about breathing out, but I'm just trying to go through this with you to make sure I understand. Because you've introduced a new concept to me. So my diaphragm's like this. What causes it to go flat?
Breathing in.
Well, when it goes flat, I breathe in. You are 100% correct. But what is my muscle doing? Muscles only do one thing. What's that?
Contract.
Contract. Okay, cool. So when I breathe out, what does my diaphragm do? Does it help me breathe out?
Contract.
So it contracts itself back up again?
Yeah.
So it can contract this way and contract back this way?
Yeah.
No.
I don't know what you said.
Muscles can only pull. They can only contract. My diaphragm does this. When it goes back up, it's just letting go. Just like my bicep can do this. When it does this, it's just letting go. It's not pushing itself back out. So your diaphragm, the point I'm trying to make is your diaphragm does not help you breathe out. It helps you breathe in by contracting. It just lets go here.
It deflates.
Yeah, it does nothing. So when you breathe out, you were right, by the way. You said serratus posterior inferior. It's the first muscle I would have picked. You were 100% right. And then one of your intercostals. I think it's your internal intercostals. Your diaphragm doesn't help you breathe out. It just lets go. Just like my bicep doesn't help my arm go down. It just lets go. It didn't help it. It let go, right? If anything, my tricep pulls my arm down, or gravity does. But my bicep just lets go. Your diaphragm's like that too. It's working in an inhalation. When you guys breathe in, don't you feel like you're working a little bit? When you breathe out, are you working? I can breathe out in my sleep. It takes energy to breathe in. It does not take energy to breathe out. Just to let go. Cool? All right. Awesome. I think that is about it. I'm going to release a test on this. And by the way, page 218 has a great picture of the ligamentum nuchae, which a lot of stuff attaches to. But that's a whole other subject.